all mothers who are first-time mothers, when they deliver, they are very concerned about whether their baby is feeding well and the baby's behavior is okay and whether the baby will be gaining weight. And there are a few tips that I would like to tell you all how to assess a newborn in the first 2-3 days of life. Hi, good morning everyone. This is our first of our series of problems in newborns and children. We will talk about the newborns today. Common issues what we see in the newborn period. All mothers who are first-time mothers, when they deliver, they are very concerned about whether their baby is feeding well and the baby's behavior is okay and whether the baby will be gaining weight. And there are a few tips that I would like to tell you all how to assess a newborn in the first 2-3 days of life. Okay. Number one, our main concerns are whether the baby is feeding well. So latching is a very important factor, and almost all mothers, before they leave hospital after delivery, they are reviewed and seen to assess whether the breastfeeding style is proper and whether the baby is really latching onto the breast. And if the latching is perfect, then the babies feed well without a major problem. If the latching is okay and the feeding is all right, how do we assess whether the baby is passing enough urine? Normally on the first day the baby may pass urine once or twice, on the second day, third day, fourth day, fifth day, the frequency of passing urine may increase one by one, and the babies feed once they are fed sufficiently, they will sleep well and get up for the next feed without a major issue. And basically we also look at whether their behavior, whether they settle down well, when they are sleeping they are not groaning and grunting, and they are fine. Other than the latching, there are a few other things I would like to tell you all, which you all people have to be careful with. One is to see the color of the baby, especially the second, third, fourth day and the fifth day, whether there is yellowness of the eyes and the body. If there is a doubt that the color is getting a bit more yellower, it is very important that you show your pediatrician and make sure that things are sorted out and the baby is otherwise well. So feeding, color of the baby mainly being jaundiced, and assessment of whether the baby is otherwise well. Your daily routines of giving a bath, whether you can use various products is something that we have to be careful with. And the water which you give the bath should be preferably sterile, and boiled cool water, body temperature water. And if the baby is very small, especially under 3 kilos, you would like to give a sponge then a bath, and if the baby is over 3 kilos, you can give a bath. We would prefer to go with products which you don't want to use unnecessarily on the baby. You just don't need anything, no soap, no shampoo, no eau-de-cologne, no powder on the body. You can use, if you want, a soap-free wash, and you can use a moisturizer or an oil after a bath, so that you keep the skin texture well and there is water within the skin. Thank you very much. We will continue this series following in the subsequent days.